Hey, folks, how's it going? Facebook Live, Dave and Dujanovic After Hours. I don't think we actually have a name for this other than an extension of the Dave and Dujanovic show. After the show, sometimes we have more things to say. I know that's hard to believe after 3 hours of talking, but yeah, we have more to say.
If you missed our show, we're on Monday through Thursday, 9 to noon on KSL News Radio 102.7 FM. Today's hot topic that lit up the phone lines, that's our after show discussion. And it has to do with this issue that was actually brought to light in a Deseret News article. Reporter Lois Collins, in fact, she joined the show today to talk about that story. And Dave, as you know, it discussed the issue that insurance companies are facing with the bills that are coming in from people who catch COVID-19, end up in the hospital. And then, of course, the bills on average, according to some websites, are about $73,000. The question Lois raised in her story in the D News is, will insurance companies continue to pay those costs now that a vaccine is available? And this is a discussion that's going on behind the scenes, she says, and with some insurance companies as to whether they continue to pay the bills of those who catch COVID-19 who have not been vaxxed, even though the vaccine is clearly readily available.
Okay, so first of all, are you really surprised that the insurance company is not wanting to pick up the tab of a huge hospital stay, whether
Forever?
it's $73,000 or $173,000?
Forever? I mean, I'm surprised they hadn't done this sooner. We're 8 months into, offering vaccines to a number of people. So I am surprised this hasn't happened sooner. I say good for the insurance companies.
And you're crazy on this, Debbie. I cannot believe you are supporting this. Okay, so let me get this straight. The insurance companies are saying, if you don't get vaccinated, then we're not going to cover your hospital bills if you end up in the hospital for COVID.
It's a discussion.
And you think that's okay?
Yeah, I do. In fact, we want your comments. What do you think? Here's why I think it's okay. I'll just lay out my argument for why I think it's okay, and then you lay out your argument. Okay, so here's what I think is, look, the insurance companies, I agree that you have the right to choose, right? You have the right to choose whether you're vaccinated or not. I just don't want to pay for your choice not to be vaccinated. So if you're in my pool, my insurance pool, Dave, and you decide you're not going to be vaxxed, now you and I are both vaxxed.
Yeah.
That's fine. Don't be vaxxed, but I don't want to have to pay your hospital bill out of my pool of insurance money.
Okay.
That's my take. It's simple.
This is so why Dave and Debbie differ daily. That is a lot of alliteration. Dave and Debbie Dujanovic differ daily. Duplicitously.
What's your take?
Okay, this is why it's such a terrible idea. You open up Pandora's box. That's exactly what this is. It's opening up Pandora's box, because if you tell insurance companies that they cannot cover you for health decisions you're making, for example, it opens up the door for this. Dave, you drink too much of this. Too much Diet Coke. We know that Diet Coke is battery acid. We know it's not good for you. It leads to problems down the road, right? So any kind of sickness or illness that you might have later on because of your terrible decision to drink Diet Coke instead of water, we're not going to cover that. Or to the smoker. Hey, listen, I know you're addicted to smoking. Your lungs are starting to fail. You're going to have to pick up these cancer treatments all on your own. This lung transplant you need, you're going to have to pick that up on your own. There's always sick people in your insurance plan. There's some people that are more sick than others. That's why you have a big group plan, because you're hoping largely that the group is healthy. And then you have a few outliers. That's what's happening with the COVID vaccine. Most people are vaccinated, at least in the dangerous hospitalization ages. right? Over 85% of people over 65 have been vaccinated. Those are the ones that are largely ending up in the hospitals.
This
So,
doesn't this doesn't impact people with pre-existing medical conditions that prohibit them from getting the vaccine, from
right.
what Lois said.
Yeah.
This
And
is
that
people
that
who are
obviously,
healthy, who are making a choice not to get vaccinated, and here's the argument I often hear. I listen to a lot of public hearings. I read a lot of news stories. I read all of the hundreds of emails that come into KSL every single week, probably thousands of emails. And a lot of those who are choosing not to get vaccinated will say, "It's my body, it's my choice." Well, it is your body and it is your choice. I respect that. It is your decision, as you say. Well, you have the right to make the decision for yourself. I suppose if you end up in the hospital with COVID-19, I can pray for you and feel sorry for you. But at the end of the day, you made that decision. That's the decision you made. That's the choice you made. And if you end up with a $100,000 hospital bill, I'm going to pray for your full recovery. But I don't wanna have to pay for that.
now,
Not with the vaccine available.
okay, so the vaccine's effective. I'm not arguing that. Of course it's effective. But we make decisions every single day in our life that are harmful to our health. For example, you eat those french fries, you go to McDonald's, you go through that drive-through, and now all of a sudden 20 years later, you need a heart transplant. That is $1.4 million. That's the average cost of a heart transplant. So are we going to say, you know what? We told you not to eat french fries. You knew better and you made the decision to do it anyway, right? Your body, your choice. You can eat those french fries
Nobody's
if you
declared
want.
French fries as a worldwide pandemic. Nobody's declared French fries as a worldwide pandemic, Dave. Occasionally,
More
yes,
people
there
are
are
dying
going to
from
be
heart
people who
disease
are
than they are from COVID.
well, Dave, I think you're talking apples and oranges. You're talking not even French fries and potatoes. You're literally like talking carrots and French fries. I mean, you're not even close with that. You're trying to compare, an eating habit with a virus that is highly contagious now that we have the Delta variant among us between people. And I do think this would be an incentive to get more people vaccinated. Let's get to the comments. We got tons of comments. Let's get those rolling. Steve Sims, thanks for watching. We all pay premiums. Why should we have to pay more to cover people that make bad choices? Steve, in fact, to your comment, we did some research today. I didn't realize this is the case because I'm not a smoker, but according to the Americans with Disabilities Act, if my memory serves, health insurance companies can charge smokers additional premiums. I believe it is 50% more, a 50% increase over what like you and I might be paying, Dave. So they do get slapped with an additional premium.
Now
That's
that is something I would be willing to have a discussion about. If you choose to not get the vaccine, then perhaps your premiums go up, right? Because you are at greater risk. I don't have any problem with that. But you need to uh, make sure that the client, us, whoever, is aware of that, saying, okay, if you make that choice, you're going to have to pay a higher premium, much like a smoker, right? The smoker says, well, I'm going to do it anyway. The French fry eater is going to say, well, I'm going to do it anyway. And many and most health insurance companies offer incentives for healthy living. So
yeah,
they'll get rebates if you're exercising or you have a gym membership, or they'll pay a portion of your gym membership.
yeah.
There's a lot of things that you can do to incentivize, but to just flatly refuse to pay for someone's hospital bills, that's a bridge way too far.
Is it Josiah, Dave? You're good with names.
Josiah Halverson, how do you
Yeah,
prove that you're in the hospital due to COVID and not something else? That might be a tough one for
that's
insurance companies.
right. I mean, that's for your doctors to decide, right? I mean, if you go to the hospital and you test positive for COVID, is that what you're in the hospital for?
Yeah. Yeah.
Um, good point. But I think that's going to be a question for the doctors and the insurance companies to hash out. How about Becky? How about Becky? Hey, Becky. Too much Diet Coke isn't the same thing as a diabetic refusing to take insulin.
That
That's why I love working with Becky, David. I'll let you answer or respond to her comment.
Yeah, I mean, listen, it's a fair discussion, right? I mean, I have no problem. The thing I'm worried about again is this Pandora's box.
Mm.
When you start allowing insurance companies to deny payment for what is quite frankly a medical choice, right? I mean, people can decide what to take into their bodies or not. And listen, the vaccine, although we've seen is wildly effective, is very safe. It is not perfect, right? Just like the flu vaccine that we get every single year. There's an outside chance that you get Guillain-Barré syndrome, right? There's that chance. So, uh, there's some people that'll choose not to get it. We make these decisions every single day. So now you're going to punish me for not take this vaccine, but not that vaccine, this diet, but not that diet. I mean,
When's the
you
last
just
time we've
can't
been
have.
in a worldwide pandemic?
Well, they can't be the puppeteer, Deb. This is the key. You
They
cannot
can
have
be.
the insurance companies
They're
be
a
the
private
puppeteer and make.
company.
You're saying they're
Dave,
fine. You're totally fine with
yeah.
them being the puppeteer.
Well, I think in this case, if it gets more people vaccinated, yeah, I'm
The
okay with
ends.
it. Look at there are plenty of exclusions on our health insurance policies. We just choose not to read them. We figure that out. Like for example, if you go out of network, what happens?
You pay a
They don't
premium.
always yeah, they don't always just pay it. You gotta fight with them to pay it. Or maybe you went to a doctor that wasn't on your long list of doctors because you misread a name or you forgot to check or something like that. You look, I've been slapped with plenty of bills, on accident from my kids who end up at the doctor they thought was covered, but not really covered. Health insurance set up the plan. I think it's our job to follow it. Maybe you need to go shop for another health insurance company. And you keep saying Pandora's box. We're in a Pandora's box, my friend. We are in a worldwide pandemic. Our numbers are not stabilizing right here. They were lower just a few months ago. Now they're getting higher. More people are ending up in the hospital. We are in the middle of a Pandora's box.
Well,
Question.
you're
Go ahead.
conflating the pandemic with the insurance company's role to take care of you.
What's going to
And if
happen,
I if
Dave?
I'm saddled with a hospital bill of one, two, $300,000 for a stay in the hospital, then I mean that financially bankrupts me.
Yeah, you're done. You're right. So again, I go back to my original point was you've made the decision for yourself. You've made the decision for yourself and for your family. And we talked to a Cass Ho on the air today. She was one of the first people in Utah to contract COVID in the early days when they didn't really even know what was going on. She called the show today to talk about this. She's very much on Team Deb on this one, and she gave us the total of her hospital bill. Now, she was covered by insurance, $100,000, more than $100,000. Do we have any more comments? Let's get to as
If
many
you're
as
on
we can. Go
ventilator
for
as
it,
well.
David.
Mitch Wright says insurance is all about risk. You are 100% higher risk being unvaccinated. You always pay more when you're at higher risk. Ask any teenage driver. Absolutely. Yeah, again, I don't have a problem with charging higher premiums. I don't have a problem with that. The discussion that's being had behind closed doors is denying payment. And that is problematic. Because again, if you think that they're going to stop right at the pandemic, Deb, if you think they're going to stop at COVID, you're crazy. Because insurance companies, they're not running a charity. They're trying to make money. And anytime they cannot pay for something, that is more money in their pocket. Okay.
Think
So
about
insurance companies are trying, let's not make them out to be, St. Peter here, that they're just trying to take care of the sick. They're running a business. They have to have some guidelines. And yeah, you'll rue the day that you supported this.
as a client of their company, I want them to be as wise as they can with my money. Frankly, I mean, do you suppose that if, 10,000 people caught COVID at $73,000 a pop here in the state of Utah, and I don't know what the numbers are, 19,000, 20,000, and they at some point all these people end up in the hospital, Dave, when all is said and done? That's tens of millions of dollars that are going out the door, all prevented. Much of it could be prevented by a free vaccine. The government is even charging us for this vaccine. And quite frankly, your argument would be great to me if you were talking about people with pre-existing medical conditions who doctors have said, look, you can't get vaccinated. It's too much of a risk. You're talking about a lot of people. We see them on the news. We see them in quotes. We've had them on our show who don't believe in vaccines. They don't believe in vaccines. They question the vaccine. They don't think that they should have to get the vaccine. It's their body, their choice. So that's the population I'm really focused on when I say, yeah, insurance companies should charge them if they end up in the hospital.
There's a lot of pressure, right? There's a lot of pressure coming from the outside. I mean, you're seeing the NFL, for example, they're saying that if a game is canceled because an unvaccinated player gets COVID, the game is going to be forfeited and no one's getting paid for that game being canceled. So there is this peer pressure, right? Because if you're costing me, and for some of these players, it's, hundreds of thousands of dollars if they miss a game, then yeah, there's a terrible pressure, and you're forcing people essentially, right? You're forcing people to get vaccinated. And I think anytime you're forcing somebody to have a medical procedure or to take some sort of a medicine, going down a bad path.
But they don't have to get it.
Let's stop pretending like
they don't have to get it.
That it's not, that it's a choice. Debbie, I'm telling you, I would stick my hand in a meat grinder to keep my job because it means that much to me, because I have to provide for my family. I will take whatever risk it is. It doesn't mean it's right. Just because I'm willing to take the risk doesn't mean it's right for my company to require that.
You talk about pressure. Look at what the Las Vegas, formerly Oakland Raiders, are doing now. And they're saying that fans have to be vaccinated. We can see this is going down a path, Dave, where the unvaccinated aren't going to be able to participate in some of the activities or enjoy the benefits and the freedoms that they've enjoyed in the past because they're not vaccinated. And what's the ticket to a Raiders game? $150, $200. It's out of my range. I'm not going to one. But this is something with the insurance companies that could bankrupt families. I think there's going to be a lot of discussions around the kitchen table about this. What do we do if we're not vaxxed? And what if there's one person in the family, the mom, the dad, the husband, the wife, who's insisting nobody get vaxxed?
There's a couple comments I want to get to. There was one from Lorraine, and then I want to get to Rainey Remke's. So if you're not wearing a seatbelt or you're not wearing a helmet, should they pay or they shouldn't pay? Right? If you're on a motorcycle and you're not wearing a helmet and you get in a crash, can you say, well, that traumatic brain injury, we're not covering it because you didn't wear a helmet. You should know better.
We just had another commenter though earlier saying, I don't know this for sure, but they don't cover for DUI accidents. So maybe this kind of falls in that same.
Well, if you're not wearing a seatbelt, if you're not wearing a helmet, both things that will keep you safe. I see where you're going with that, Lorraine, and I really agree. I think there's a lot of things that happen, a lot of sad things that happen that are probably even preventable. But we treat people anyway, and we cover their costs in insurance. What we're hoping, though, and this is how the insurance program works, is we're hoping that the majority of people make the right decision, that the majority of people wear a seatbelt, that the majority of people wear a helmet, because that will cancel out the knuckleheads that are out there driving their motorcycle without a helmet. Why should I pay for people to get sick? Let's see. Sorry.
I'm not sure we I've pre-read that. Why should I pay? Okay, we've switched that. I didn't quite understand what that question was. Maybe retype it for us. Jill Smith, it should be covered at the regular insurance coverage, but their premiums should go up. Lots of diseases are based in stupid choices, and we still cover them. They do. We talked about this earlier. We've hit on this a few times, and that's with the smoking. They do have the right to increase premiums for smokers.
Yeah. The discussion of whether or not to increase premiums, totally fair. I'm totally fine with that discussion. It's too far when you say we're going to cut off the coverage. We're no longer, you're too much of a risk, because there's so many things that we do in our life that's too much of a risk.
Now, do we have any more comments there, Caitlin? And get to maybe a couple
Okay,
of more.
sorry, we couldn't process. We're reading these live, so I couldn't process the questions. So anyway, we want to tell you guys, thank you so much. Thanks for your comments. The conversation is great, because this is one of the things I love about getting so angry with Debbie. She makes me think, she makes me rethink, and that's what you guys do when you send us your comments. You give us a new perspective, a different way to look at things. I really like that comment that Becky Bruce made, comparing it to insulin shot. If a diabetic chooses not to use insulin, what responsibility do they hold, and what should fall on me? So anyway, we appreciate it. Thanks for joining us. I think we'll wrap things up. I don't think we have any more comments. I know we have a ton more comments, but
see you tomorrow at 9 a.m. on the David Dujanovic Show. We launch the show at 9 a.m. to noon, Monday through Thursday. And if you can't tune in, it's okay. You can always just say, Alexa, play KSL News Radio.
podcast.